Welcome back to Plastic Surgery Untold. We're at Octane, which is one of my favorite conferences. There's so many new things, and ran into a few celebrities here, but I really want to talk about one of our favorite products, CO2Lift. I mean, there's a lot of things out there. I was a little hesitant because I didn't really believe it, but it's transformed your practice, and we're lucky to have the CEO, founder of the company here to share some of that with us.
Mm-hmm. That's right. I'll be honest. Like you, I would say a skeptic of the product itself. And I think for anybody watching that, the product itself is figuring out a way to deliver CO2. Lana's going to correct me if I'm wrong here, but delivered CO2 subcutaneously, trick the body into thinking it's low on oxygen to basically then increase oxygenated or arterial blood flow, and from a surgeon speak, essentially save tissue that was threatened from a skincare standpoint, make the skin look healthier, make it glow better. Really just a phenomenal product. I started as a skeptic and I'm a believer now, and we use it wholeheartedly all the time.
Well, and because, as technology has gotten better, we've gotten more aggressive with this whole transition with the GLPs, there's been so much more high definition, soft definition, so much more energy, right? Because we're treating skin laxity. So you can only apply so much pressure on the skin before you start pushing the limits a little bit. And that's where your real development has come in, because it's used to, I think when it started was more just med spa, topical skin, and really has evolved into the surgeon's world pretty immensely.
Yes, I think it started when we did our clinical study on diabetic ulcers, when we saw how quickly that healed in the pilot study that was able to close a non-healing diabetic ulcer in as little as 8 days. And that's when it caught the attention of plastic surgeons like yourself. And we're just truly excited, because what they're calling it is the new gold standard in post-procedure.
I love the product. I mean, I was actually telling Lana, we did a, like you, we're doing some body contouring, somewhat aggressive lipo, high def, tummy tuck, and just an area that, a little bit of threatening skin on that inferior border portion. Sent the patient home with 5 treatments of the CO2Lift, and it took care of it. Something that I wouldn't necessarily think, honestly, I wouldn't have thought we could have done.
With all of our, high definition energy combination, we don't even give them a choice anymore. Because at this point, trying to wait for a problem, is something that I don't want to do. I think also at this point, how do you differentiate yourself from all the other practices out there? And people don't know, oh, well, you're doing X, Y, and Z. All they know is, my friend went down the street and had problems. I went here and I recovered really fast. Even little things that are annoying where they're eventually healed, but some prolonged bruising, some prolonged things that just, summer season's coming soon, and so you want to be bikini ready.
Yeah. And to your point, actually, we're such a huge believer in the product. Anyone that comes in for a consultation, we actually give them a skincare treatment with it, just to show people the true power of it. And it's a great experience for the patient. It shows them that this product works, and then they understand why, if we use it in the future, what it will do and help them out with. We absolutely love it.
And there's a lot of versatility, because I think one of the things, so people don't get confused, is a lot of times we'll apply it in the office, but it's also something that most of the patients end up doing at home on their own. It's 45-minute treatment, super easy, face, body, kind of anywhere.
Exactly. We have, and one of my special passions is the one for the vulval vagina. So, that area I think is really getting very hot, if you want to call it that. That's the direction that women are going in, and in quality of life. And so to be able to have something that they can control from the privacy of their home, I think is just remarkable, and that you can offer to the patients too at home.
The versatility.
Yeah, I think the point of that, you can give it to somebody from home is a huge game changer, right? Because for us, I think as plastic surgeons, we have 2 options. We have this product, and we have hyperbaric oxygen chambers, right? And I love hyperbaric oxygen chambers, but we are limited by the availability of the text and the openness of that chamber itself. And with this, we can actually say, go home. You can do this once, twice a day, do it for 3, 4, 5 days. Just opens up a whole new treatment method that is not available, right?
And something that you can implement, patients can do at home, they can do in their office, because not everybody has the space for a hyperbaric chamber. If you don't have a large practice, it can be really challenging. And I don't know about you, but it's hard to find people in town that even want to see your aesthetic patients, because they're such an insurance thing. And so it's really great to just make a treatment like this accessible for our aesthetic patients, whether it's just trying to decrease their bruising, trying to recover by the weekend for that pool party, whatever it is.
But I think also too, from the patient's perspective, it's just when the patient has surgery, they go and they feel almost helpless. The psychology of the patient, to be able to have something that they feel they have some control over their healing, I think from a psychological standpoint for the patient is only going to help them as well.
I think no question. It's giving patients something to do is helpful, because they're going to find something to do one way or another. And so, for all of you patients that are listening, do the things we ask instead of just the things that say on TikTok, unless the TikTok came from us.
That's right.
Exactly.
I saw this. I read about this.
Well, I can't thank you guys enough. I know you guys are super busy, so appreciate y'all taking some time. Plastic Surgery Untold, greatest podcast in the world. But before we go, tell people your handle, where they can find both of you.
Lana, please, I don't.
At CO2Lift.com and my personal, the Lana Kerr.
Ooh, I love it. I'm Dr. Matthew Nykiel. We're here in Newport Beach at SoCal Plastic Surgery.
We can actually look out the window and see your
That's right, it's right there.
gorgeous location. Congratulations. Congratulations. All right, we'll see you guys. Bye.